cervical fascia. Actually, we want to talk about deep cervical fascia and understand deep cervical fascia is three parts which we have to focus upon. Namely, there is the most superficial investing fascia. But why the most superficial will be called as the investing fascia? Investing, like the shirt, it is most superficial, and it is investing the arm like that, investing. Oh, covering, yes, the most superficial investing fascia. If I remove it, then deep to that, if you remove this, deep to that, you will have under banyan. So what is that under banyan? That will be the deeper layer. Yeah, who is the deeper layer? See, first there is investing fascia, remove it. Deep to that will be two types. What are the two types? Actually, you will see that these are all deep cervical fascia. There is one in front of the trachea, so you will say pre-tracheal fascia. So if I remove the investing fascia in front of trachea, there is a pre-tracheal fascia, yes, and then there is a prevertebral fascia. Prevertebral fascia, I think prevertebral fascia which was at the floor of the posterior triangle, yes, floor of the posterior triangle there. You mean to say removing the investing fascia, I will see the prevertebral fascia at the floor of the posterior triangle? Yes, roof is investing fascia and the floor is the prevertebral fascia. Let us see some diagram for that purpose. But there are three layers and all the three will contribute to carotid sheath. Carotid sheath, the one which is in the carotid triangle containing some neurovascular bundle. Yes, there is a carotid sheath which is contributed by all the three. How? Anteriorly it will be, means more superficially it will be investing fascia, and anteriorly pretracheal fascia, and posteriorly prevertebral fascia. So telling carotid sheath has three contribution. Yes, more superficial is investing, and what is anterior? Pretracheal, and what is posterior? Prevertebral. Can we see some diagram for that? Yes, see the diagram. Again, this lady comes with long neck. Yes. You want to discuss three fascia now? Yes. This three fascia. You have already known the names. Let us look at them. Remove the skin and then you see the fascia. So removing the skin, we see the fascia. Which fascia? You see this is the most superficial, which is investing fascia, and then deeper could be pretracheal or prevertebral. There are three layers of deep cervical fascia. So these are the three layers of deep cervical fascia. Yes, and see the most superficial out of the three is investing fascia, which is forming the roof of the posterior triangle. Oh, this is posterior triangle. How do you know this is posterior triangle? Because the anterior muscle is sternomastoid and posterior is trapezius. Oh, like that, yes. So investing fascia is forming roof of the posterior triangle bounded by sternomastoid anterior and trapezius posterior. And one more thing, what? This fascia will come and split and close the sternomastoid, will come and split and close the trapezius. So this fascia is coming and it is splitting and closing the sternomastoid, then split and close this trapezius also. Yes, like that. Splitting and closing muscles. So you're telling investing fascia came and split and closed the sternomastoid, then it was forming roof of the posterior triangle, then it was splitting and closing sternomastoid. Where is it going? Posteriorly. It is all around the neck. So it is all around the neck circumferentially. Yes, it is all around the neck circumferentially. What if I remove it? Strip it out. If you strip it out, then you will see the deeper fascia, which is deep cervical fascia, but it's called prevertebral fascia. You mean to say, if I remove this roof of the posterior triangle, I'll reach the floor of posterior triangle? Yes, you remove the roof, you see the floor. At the floor of the posterior triangle, you will see the prevertebral fascia, because in front of the vertebra and covering the muscles of the floor of the posterior triangle, like it is scalenus medius muscle. So it is covering scalenus medius muscle there. Yes. Okay. At the floor of the posterior triangle. Yes. Then there is one fascia which is in front of the trachea, and pretracheal fascia. So this fascia is in front of the trachea, the pretracheal fascia. I don't think it is only front of trachea, it is going around the trachea. Yeah, it is also circumferential. It is in front of the trachea, on the side of the trachea, and then it will go behind the esophagus. Go behind the esophagus. Pharynx esophagus? Yes, pharynx esophagus. You mean to say pretracheal fascia, yes, is not only in front of trachea but anterolateral to trachea. Yes, it is anterolateral to trachea, covering the trachea. And what is it doing then? Going behind, it is circumferential. But when it go behind, it will go behind the pharynx and esophagus. And when it goes behind the pharynx esophagus, it will change the name behind. It is called buccopharyngeal fascia. Buccopharyngeal fascia. So telling first is pretracheal fascia becoming circumferential and then go behind the esophagus pharynx to become buccopharyngeal fascia posteriorly. Yes, let us see a diagram for that. But this fascia is enclosing the trachea and esophagus. So this fascia is enclosing trachea, esophagus. Yes, respiratory tube and gut tube enclosed by this fascia. It also encloses the anterior neck muscles. It also encloses the thyroid gland separately. It has multiple layers. You're telling pretracheal fascia has multiple layers. Yes. Enclosing what? It'll enclose the anterior neck muscle, and it'll enclose the thyroid gland, and it'll enclose the trachea, esophagus also. Oh, it has multiple layers to enclose various things. Yes. Right. What is this? This is carotid sheath with the carotid artery. Which carotid artery? Common carotid artery, internal carotid artery medial, and internal jugular vein lateral. And between the two, behind the two, is vagus nerve, covered by carotid sheath in the carotid triangle. Contributed by what? Carotid sheath. Yes. Carotid sheath is contributed by three fascia. Can you tell me the name of three fascia? Name of three. Carotid sheath is contributed by three fascia. I think posteriorly it was prevertebral fascia. Yes, correct. Anteriorly it was pretracheal fascia. Correct. Can you tell me who was the lateral contribution? Lateral must be the investing fascia. Lateral must be the investing fascia, lateral contribution to carotid sheath. This is the carotid sheath there. So that is the carotid sheath there. Yes. And it is getting some lateral contribution now. Yes. By investing fascia. Yes. That's the point. Okay. Let us do one thing. Take a transverse section here. Transverse section of the cervical region. Yes. To see the various layers of fascia. Yes. Not only fascia, some spaces also. These days, examiner are asking you the fascia and the spaces. So let us see them. This is superior view of the individual. This is superior view of individual means you are taking a transverse section now. Yes, superior view. Nose will be anterior. This is right ear. So that view, yes. In the neck region, yes. So you are taking CT scan kind of thing. Yeah, it is CT scan kind of thing, but nose is anterior. This is right side ear. Okay, so you have taken a transverse section. Transverse section. Yeah, transverse section. I think this is the investing layer most superficial. Yes, that is the investing layer most superficial. Now, when you say this is the investing layer most superficial, I think it is splitting and closing some muscle. Yes, it is. And it is forming roof of the posterior triangle. Again, splitting and closing some muscle. Yes. And circumferentially going like this. Yes. But it split and close this muscle and then go like that. Investing fascia. Yes. Most superficial, deep cervical fascia. Yes. What is it? Splitting and closing some muscles. Like sternomasstoid trapezius. Yes. Not only sternomasstoid trapezius, but it has some other job. It is the most superficial deep cervical fascia forming roof of the. It is forming roof of the. It is forming roof of the posterior triangle. But how do you know this is posterior triangle? Because this is the sternocleidomastoid muscle and that is a trapezius. Oh, this is trapezius posteriorly, this is sternocleidomastoid anteriorly. I think bounded by the two is the posterior triangle, and this is the roof of the posterior triangle. Yes, formed by investing fascia. So sternomastoid is anterior and the trapezius is posterior, and this is the posterior triangle having a roof of the investing fascia. What is it? The floor? Floor. You know. Floor is a fascia which is in front of the vertebra. So this is the vertebra here. Yes, that is vertebra. In front of vertebra, prevertebral fascia. So this is prevertebral fascia. I think this prevertebral fascia is not only in front of vertebra but around the paravertebral muscles. Yes, around the paravertebral muscles. It is enclosing the paravertebral muscles. So this is prevertebral fascia, called so because in front of the vertebra, but it is enclosing the paravertebral muscles. Yes, and forming the floor of the posterior triangle. I think this is the roof of the posterior triangle. This is the floor of the posterior triangle. Yes. That is the roof which is formed by investing fascia. This is the floor which is formed by prevertebral fascia. Then what about the pretracheal fascia? This is the pretracheal fascia. It is in front of the trachea. But not only in front of trachea, it is going anterolateral to trachea. So it is going anterior and lateral to trachea. What when it goes posterior to trachea? When it goes posterior to trachea, actually it is going posterior to esophagus also. So what it will do when it is going posterior to esophagus also, then it will change the name and it will called as the buccopharyngeal fascia. So pretracheal fascia is continuous with the buccopharyngeal fascia which is behind the pharynx and esophagus. Yes, behind the pharynx and esophagus. And what do you know about this carotid sheath? The carotid sheath, yes. Actually, carotid sheath is enclosing this, the vein outside, artery inside. What vein outside? The internal jugular vein outside and the internal carotid artery inside, and this nerve also, that is the vagus nerve. My point is, who is contributing here? The carotid sheath, yes. Carotid sheath has three contributions. Anteriorly, it is the pretracheal fascia, and posteriorly, it is the prevertebral fascia, and laterally, it is the investing fascia. So you are telling this is the carotid sheath, yes, and this carotid sheath has a lateral contribution by the investing fascia, most superficial fascia, yes, anterior contribution pretracheal fascia, and posterior contribution prevertebral fascia in front of the vertebra. Yes, that is the point which you have to understand. This is carotid sheath, three contributions. Now, once you have that kind of idea there, move further. As you're moving further, you will see the various layers of the pretracheal fascia. I told you pretracheal fascia has various layers. What are the various layers then? See, there is a visceral pretracheal fascia. And why it is called visceral pretracheal fascia? It is called visceral pretracheal fascia because it is enclosing the viscera. What viscera? The thyroid gland. This is isthmus of thyroid gland. So this is thyroid gland, isthmus of thyroid gland. Yes. It also encloses what? Trachea and esophagus. You are telling that there is a pretracheal fascia which is in front of trachea, but it is also going around the trachea esophagus. Yes, and it has several layers like visceral layer. Why it is called visceral layer of pretracheal fascia? Because it is covering viscera. What viscera? It is covering the thyroid gland, the lobes of thyroid gland, isthmus, and the trachea and esophagus. So there, what will you call it as? Behind the esophagus pharynx. Behind the esophagus pharynx, I will call it as buccopharyngeal fascia. So there will become buccopharyngeal fascia behind the pharynx, esophagus. Yes. Pretracheal fascia is this, and the pretracheal fascia is anterolateral to trachea. Yes, it is anterolateral to trachea, but when it goes behind, then it will become buccopharyngeal fascia. I think behind that is some space. Behind what? Behind the buccopharyngeal fascia. Yeah, behind the buccopharyngeal fascia. And behind the pharynx, you have retropharyngeal space. What is retro? Retro means behind. So behind the pharynx is retropharyngeal space. Yes, behind the pharynx, and also behind the retropharyngeal, behind the buccopharyngeal fascia, you have retropharyngeal space. Okay. So what was this superficial layer of deep cervical fascia? Superficial layer of deep cervical fascia is nothing but investing fascia. That was investing fascia. So that is investing, the most superficial. Yes, most superficial. You know, this is the most superficial. And it is splitting and closing some muscle, splitting and closing some muscle. Okay, what about the other details. If you want the other details, then you have to look into some other diagrams. Other diagrams like some diagrams will come, but one question has come. Tell me the answer. Exception? Yes, exception. It is asking me some ligament of Berry. Yes, ligament of Berry. Tell me what is the answer. I think ligament of Berry is a modification of deep cervical fascia. Yes, you are correct. It is a modification of the deep cervical fascia and fixing the thyroid gland to the larynx. And where in the larynx? It is on the cricoid cartilage. You know, when we are swallowing, the larynx goes up, down, up, down. Thyroid gland also goes up, down, up, down. Why? When we are swallowing, the larynx goes up, down, and thyroid gland also goes up, down. Why? Because larynx is attached to thyroid gland by ligament of Berry. That's why. So ligament of Berry is a modification of the deep cervical fascia to fix the thyroid gland to the larynx cricoid cartilage. Can I see some diagram for that? Yes, diagram is coming, but this is a correct statement. So that is a correct statement? Yes, it is a correct statement. Diagram is about to come. Okay. Fine. What about this one? This, you know, is wrong. Why it is wrong? Why this is the answer? This is wrong. This is the answer because prevertebral fascia is not the roof. Then who is the roof? Investing fascia. So if investing fascia is the roof, then what is this prevertebral fascia? It's a floor. It's a floor. That's why this is a wrong statement and this is the answer. So telling this the answer, yes, because it's a wrong statement. Yes, because prevertebral fascia is not the roof and it is the floor of posterior triangle. Yes, covering the scalenus medius muscle there. And who is the roof? Roof was investing fascia, if you remember. And what about the ansa cervicalis embedded to the anterior wall of carotid sheath? Yes, of course, supplying omohyoid muscle, sternohyoid muscle there. It's a correct statement. And what about the carotid sheath found by pretracheal fascia anteriorly, prevertebral fascia posteriorly? I think there was one more. Yes, that was laterally the investing fascia. That was laterally the investing fascia. So this is a correct statement. Of course, it's a correct statement. The wrong statement you already have found. So this is the answer. Yes, that is the answer. Can we discuss this ligament of Berry now? Yes, you will discuss the ligament of Berry, but keep this answer. Okay, tell me about the ligament of Berry. If you want to look at the ligament of Berry, then look at this person. Again, this person. Yes. Why? Because you want to see the ligament of Berry. You are pushing the thyroid gland to one side. Which side? Maybe right side. So you are pushing the thyroid gland to one side, maybe right side. Yes. Why? Because you want to see what? The modification of deep cervical fascia. Modification of deep cervical fascia means this is the ligament of Berry attaching thyroid gland here. Yes, that is actually the thyroid gland there. So this is the thyroid gland. Yes. And that is ligament of Berry. Yes. And attaching to where? Attaching to this cricoid cartilage of larynx. That is the cricoid cartilage of larynx. So cricoid cartilage of larynx. Yes. That is the ligament of Berry. Can I have a look over that in one or other view? Yes, the other view you want, then we will see. It is the front view, and if you want the side view, then we can see the side view. It is here. What is this? Actually, you are telling this is thyroid gland. Yeah, I can see that. And thyroid gland is anteriorly attaching to the cricoid cartilage. Attaching to cricoid cartilage of larynx. Yes, by this ligament of Berry. So this is the ligament of Berry now. Yes, that is the ligament of Berry, and it is a modification of deep cervical fascia. So you are telling that this is the thyroid gland here. Yes, attaching to the cricoid cartilage of larynx anteriorly. Yes, that's why whenever we are swallowing, the larynx is going up, down, up, down, up, down. Along with that, the thyroid is also going up, down, up, down, up, down, along with swallowing. Because of that ligament of Berry, which is a modification of deep cervical fascia. Now let us take a sagittal section. Let us take a sagittal section of the neck region to discuss the cervical fascia, and it is here. What is this? This is the lateral views. You are taking a sagittal section. So when you are looking at the lateral view and taking a sagittal section, what do you want to see there? What you want to see there is 3 fascia and 3 spaces. So you want to see 3 fascia and 3 spaces? Yes. But later I will add 2 more fascia. So total 5 fascia. Total 5 fascia. 3 plus 2, 5 fascia. Yes. And 3 spaces. Yes. But first 3 fascia and 3 spaces. Okay. What about that? See, we have discussed which is the most superficial. Most superficial, I think. Investing fascia? Yes. What is behind that? Behind that must be the pretracheal fascia. Yes, but pretracheal fascia is not only anterior, it is also posterior. Yeah, I know. When it is posterior, it was modified. Yeah, what is the name? When it was posterior, it was modified. It was called buccopharyngeal fascia. So buccopharyngeal fascia is the posterior modification of the pretracheal fascia. Yes. What is behind that? Behind that is a space, retropharyngeal space. So behind that is the space which is retropharyngeal space, right? What is behind that? Behind that is a fascia. What fascia? That is in front of vertebra. Yeah, what is in front of vertebra? Prevertebral fascia. Yeah, okay, prevertebral fascia. What is in front of prevertebral fascia? Understand, what is behind the buccopharyngeal fascia is called as the retropharyngeal space. Retropharyngeal space, because it is behind the pharynx. And what is in front of the vertebra, actually in front of the prevertebral fascia, is called as prevertebral space. So there is a prevertebral space in front of the prevertebral fascia. Yes, actually vertebra will be covered by the prevertebral fascia, and in front of that is prevertebral space. Now there is a third space which is called danger space. And where is danger space? I'll tell you. This prevertebral fascia, yes, is splitting into 2 layers. So when you say the prevertebral fascia is splitting into 2 layers, what are the 2 layers? You will find that description now in the next diagram. Then you can discuss the danger space also. So what are we looking at? You see here, this is the most superficial, which is called as the investing fascia. And what is behind that? Behind that is the muscular portion of pretracheal fascia, which will cover some strap muscles. I told you pretracheal fascia has various layers, and this is the muscular layer to cover the strap muscle. And then it has visceral portion also to cover the viscera. What viscera? It is the pretracheal fascia only, but visceral portion which will cover the viscera like thyroid gland, trachea and the esophagus. So pretracheal fascia is having some muscular portion to cover muscle, yes, and visceral portion to cover viscera, yes. Okay, pretracheal fascia itself has multiple components, yes, that's the point. And then it is going behind the pharynx esophagus. As it was going behind the pharynx esophagus, I think it was modified. Yes, it was modified, and there you will call it as buccopharyngeal fascia. So there we will call it as buccopharyngeal fascia. Fine. But what about the danger space? You are talking about danger space? Yes, danger space. Now comes the danger space. You know, I told you that there is this prevertebral layer of the fascia. Yes, prevertebral. In front of vertebra here. Yes. So this is the prevertebral fascia. It is splitting into 2 layers. There is a prevertebral fascia which is proper, and there is one anteriorly coming which is called alar, component of the prevertebral fascia. So you're telling that prevertebral fascia itself will divide into 2? Yes, there is one anterior component which is called alar fascia, and there is a posterior component which is called as prevertebral fascia proper. So prevertebral fascia divides into two, and there is a anterior layer which is called alar fascia, and posterior it is called prevertebral fascia proper. Yes, what is between the two? That is the danger space. So danger space is due to splitting of prevertebral fascia. Yes, as the prevertebral fascia splits, it encloses the danger space. Why it is called danger space? It is called as danger space because infection of the neck can enter the mediastinum. You mean to say like pus? Yeah, pus. Where the pus came from? Maybe TB vertebra, tuberculous vertebra. So there was some tuberculous vertebra and pus into the danger area now. Yes, and from the danger area in the neck region, it is going into the mediastinum. Why this danger space is continuous with mediastinum? Yes, the neck infections can move into mediastinum through this danger space. So that is a potential space. Basically, it's a potential space. It is not actually seen, but it is a potential space, can be distended by pus and moving into the mediastinum. So briefing, but we have to discuss more details now. Like what details? You see, we are supposed to draw this diagram. So if you're supposed to draw this diagram, what diagram will you draw? Actually, what we'll draw is that this is vertebra. Yeah, okay, fine. And then in front of vertebra, there is one fascia. Which fascia? That is called as the prevertebral fascia, and which is splitting into two layers. What is the anterior one called? The alar fascia. So you are telling that alar fascia is a part of the prevertebral fascia only? Yes, anterior portion. And once it has given anterior portion, what is this called? This will be called as proper prevertebral fascia. So this is proper prevertebral fascia, and this is the alar fascia. Yes, like that. So there was a prevertebral fascia which is now splitting into two, and posteriorly it will be called proper prevertebral fascia, and anteriorly it will be called alar fascia. I think between the two you have danger space. Yes, between the two we have danger space. It is called danger because any pus accumulation because of some tuberculous vertebra, TB vertebra, pus here can move into mediastinum. It is spreading the infection from neck region to the mediastinum, thorax region. And what else? You have to understand that there was one more fascia. What is that? There was one more space also. What space? Actually, in front of the vertebra, I told you there is a prevertebral space. In front of the vertebra, there is a prevertebral space. Yes. In front of that you have prevertebral fascia. Yes. And in front of that you have danger space. Yes. Can you tell me the arrangement again? See, most posterior is vertebra, and in front of vertebra you have prevertebral space, and in front of that you have prevertebral fascia, which is again splitting into two layers. So what is in front of the proper prevertebral fascia? Danger space. What is in front of danger space? Alar fascia. What is in front of alar fascia? One more space. We told three spaces. Three spaces. Are you talking about retropharyngeal space? Yes, retropharyngeal space. Third space. Second space. First space. Who is the first space? That is in front of vertebra, prevertebral fascia space, prevertebral space. And what is the second? Danger space. What is the third? Retropharyngeal space. Why would you say retropharyngeal space? Because it is behind the lumen of the pharynx. But if it is behind the lumen of the pharynx, then what is behind the pharynx? There was some fascia. Yes, there was some fascia. Actually, it was a fascia all around here, but it was modified here so that we were calling it as it is the buccopharyngeal fascia. Buccopharyngeal fascia, you mean to say modification of the pretracheal fascia which is in front of the trachea? Yes, pretracheal fascia in front of the trachea, but it is anterior and lateral. It is not posterior. Posterior, it is fusing with the buccopharyngeal fascia. So there is some pretracheal fascia which is anterolateral and posterior fused with the buccopharyngeal fascia. Yes. Can we see the arrangement again? You see, this is lumen of the pharynx, and what is behind that? The modification buccopharyngeal fascia, which is behind that. Behind the pharynx, what do you have? Retropharyngeal space, and behind that the alar fascia, part of prevertebral fascia, behind that danger space, and behind that prevertebral fascia proper, and behind that prevertebral space, and behind that the vertebra itself. And what is in front? What is in front of what? In front of the pharynx. In front of pharynx you will have the trachea, and what is in front of trachea? The pretracheal fascia. So this is pretracheal fascia coming in the trachea anteriorly. Yes, not anteriorly, anterolaterally, but posterior is modified. So this is the arrangement you wanted to know. Yes. Okay, fine. Let us now look at the superior view of the neck region to discuss the same story again. So you want to look at the superior, means transverse section, and this is anterior and that is the right side, isn't it? Yes, that view. This is the diagram. You will see the 3 fascia and 3 spaces again. 3 fascia, 3 spaces. Yes. What are they? You see there is a prevertebral fascia in front of that, alar fascia in front of that, buccopharyngeal fascia. What is that? See, most posterior prevertebral fascia, it is splitting anteriorly, giving alar fascia in front of that buccopharyngeal fascia, and between them some spaces. Between them some spaces. What spaces between them? Can you see this is the vertebra here? Yeah, I can see the vertebra here. Can you see in front of vertebra there is a fascia? What fascia? Can you see in front of the vertebra there is a fascia which is going, I'll use the other color, which is going around the paravertebral muscles. Yeah, fascia going around the paravertebral muscles, I know. This is prevertebral fascia you're talking about? Yes, prevertebral fascia. It is in front of vertebra. But it will split into 2. And what is the anterior component? The anterior component is called as alar fascia. Anterior component is called alar fascia. So you're telling that this prevertebral fascia was splitting anteriorly and this alar fascia. That is what you marked here. Yeah, you can see here. See, what is prevertebral fascia? That green color we have marked now. And what is alar fascia? That red color we have marked now. And where is buccopharyngeal fascia? Of course, behind the pharynx. And if you say behind the pharynx, that means it will be somewhere here. Yes, here. So you are telling this is the trachea. Yes, trachea. This is the esophagus or maybe pharynx. Yes. This is trachea. This is esophagus or pharynx. Behind that you have modification of the pretracheal fascia. And when the pretracheal fascia is modified, it will become buccopharyngeal fascia. So most anterior buccopharyngeal fascia. Behind that is the alar fascia. Behind that is prevertebral fascia proper. And what is the spaces? Spaces you want to see. See the spaces here? What spaces are there? Let us see the spaces. But let me rub this off first. So you will rub it off. Yes. Then it will become clear. Yes. You can see the fascias clearly now. Which fascias we can see clearly? You can see here the fascias we are talking about. This is the prevertebral fascia, this is the alar fascia, and that is the buccopharyngeal fascia. Buccopharyngeal fascia. So that is buccopharyngeal, yes, and this is the alar, yes, and this is the prevertebral fascia. Yes, that is prevertebral fascia. You see, this is prevertebral. So this is prevertebral fascia, yes, and it is now splitting, yes, and because it is splitting, it is forming alar fascia, yes. I think the space between 2 is danger space. Yes, correct. See, this is prevertebral fascia. It is splitting to form the alar fascia, and space between the 2 is the danger space. I think if this is the danger space, then in front of that, but behind the buccopharyngeal fascia, in front of alar fascia, but behind the buccopharyngeal fascia is this space. Yes, that space. Retropharyngeal space. Yes, retropharyngeal space. What is the arrangement again? See, do you see the vertebra? Yes. You see some space in front of vertebra? this vertebra in front of that some space. Yes, I know, pre-vertebral space. So these are the three spaces, you see. This is the vertebra in front of that pre-vertebral space, and then you have the prevertebral fascia, and then you have the danger space, and then you have the alar fascia, and then you have the retropharyngeal space, and then you have the buccopharyngeal fascia. Anterior to posterior, no problem. Buccopharyngeal fascia behind the pharynx, yes. Retropharyngeal space behind the pharynx, yes. Alar fascia, yes. Danger space, yes. The prevertebral fascia, yes. And the prevertebral space, yes. And the vertebra, yes. Correct. Correct. So this is what we wanted to know. And once you have that orientation, see this question: where is danger space? Tell me the answer. One of the Jipmer question this year. Tell me the answer. Danger space. Yes, I know the answer. Yeah, you know the answer. Tell me. And it is here. Yeah, correct. Because we have told prevertebral fascia split anteriorly, forming alar fascia, and between the two is danger space. So that is the answer. Keep the answer there. As you keep that answer there, this is the diagram which we'll be quickly looking at now. To discuss some of the nerves, there are some questions asking A, B, C, D, nerves. Identify the nerves. So you have to identify the nerves then. But first the fascia. This is the pretracheal fascia, which is anterolateral, but when it goes posterior, it will go behind the esophagus and pharynx and will be modified as buccopharyngeal fascia. And this is the prevertebral fascia, which is in front of the vertebra, but then it is around the paravertebral muscles. And then this is the investing fascia, which is the most superficial, and this investing fascia is called so because it is splitting and closing sternomastoid and also the trapezius. And after that it is forming the roof of this posterior triangle. Roof of posterior triangle bounded by the two muscles. You mean to say this part here? This part here? Yes, that is the roof of the posterior triangle. And then this is the carotid sheath containing the common carotid artery and internal carotid artery and interjugular vein and the vagus nerve between the two, behind the two. Okay. This is the vagus nerve between the two, behind the two? Yes. Inside the carotid sheath. Then this must be the ansa cervicalis embedded anteriorly to the carotid sheath. Yes, this is ansa cervicalis embedded anteriorly to the carotid sheath, supplying the muscles like the omohyoid muscle and the sternohyoid muscle there, anterior neck muscle. And then this is the brachial plexus. Where is brachial plexus? Brachial plexus is at the floor of the posterior triangle. You say brachial plexus is at the floor of the posterior triangle. I think it is between the two muscles, namely the scalenus anteriorly and scalenus medius posteriorly. Yes, interscalene triangle. Interscalene triangle. This is the interscalene triangle. So this is scalenus anterior. Yes. And this is scalenus medius. Yes. And this is the floor of the posterior triangle. Yes. There you have the, I think this brachial plexus. Yes. Is pulling this prevertebral fascia into the axilla to become axillary sheath. Yeah, correct. That is correct. The brachial plexus will pull the prevertebral fascia, which is in front of the vertebra here, forming the floor of the posterior triangle. Roof is the investing fascia. See, brachial plexus is here, you are telling. In front of vertebra, you have prevertebral fascia, which is covering the scalene muscle, and it is pulled by brachial plexus into the axilla to become axillary sheath. Axillary sheath is a continuation of prevertebral fascia, which is at the floor of the posterior triangle, covering the scalene muscle. And in the interscalene triangle, you have brachial plexus. And what is this? This is the magnified view we have to see. You are magnifying the carotid sheath content now? Yes. Why? Well, just to see some details. What details? You see, this is the internal carotid artery inside, internal jugular vein outside. So this is common. Yeah, common, doesn't matter. Later it will become internal. So internal or common carotid artery on the medial side, interject vein on the lateral side, and this is the ansa cervicalis embedded anteriorly to the carotid sheath, and behind that is stellate ganglion block. You remember? Stellate ganglion block. Behind the carotid sheath, you have the sympathetic chain. Now we have to see some more nerves. In fact, which more nerves? See, this is the trachea, and this is the esophagus, right? And this is the lobes of the thyroid gland. Okay, the lobes of the thyroid gland connected by some isthmus of the thyroid gland. Isthmus of the thyroid gland here? Yes, isthmus of thyroid gland connecting the two lobes. And close by visceral layer of the pretracheal fascia. If you say this is the visceral layer of the pretracheal fascia covering the viscera, then who is covering the muscle? Muscular layer of pretracheal fascia. Which muscle? The muscle which are anterior neck muscle, like sternohyoid. So sternohyoid is anterior neck muscle covered by some muscular layer of pretracheal fascia. Yes. And then it has visceral layer covering the viscera like trachea, esophagus and the thyroid. Yes, I told you pretracheal fascia has multiple layers. Some cover the viscera, some cover the muscle. And what about this artery? This is the common carotid artery, internal carotid artery. And what is this nerve? The vagus nerve. Now remember, the vagus nerve is giving branch. Where? In the tracheo-esophageal groove. What is the name of that nerve? You are telling this is vagus nerve? Yes. Between the two, behind the two. Inside the carotid sheath. So inside the carotid sheath, between the two, behind the two, the vagus nerve is giving a branch which is running in the tracheoesophageal groove. The nerve which run in the tracheoesophageal groove, I think it is recurrent laryngeal nerve. Yes, recurrent laryngeal nerve, branch of the vagus nerve, tracheoesophageal groove, surrounded by which fascia? Enclosed by which fascia? I think enclosed by pretracheal fascia. Yes, correct. What is this fascia? That must be the buccopharyngeal fascia. Yes, that is correct. Buccopharyngeal fascia continues with pretracheal fascia anteriorly. So buccopharyngeal fascia is posterior and pretracheal fascia anterior. Yes, of course. Then what is behind the buccopharyngeal fascia? Behind the buccopharyngeal fascia is the space which is called retropharyngeal space. Retropharyngeal space. So this is the pharynx or maybe esophagus. Yes, pharynx, esophagus. And then you have buccopharyngeal fascia. Yes. And then you have the retropharyngeal space. Yes. That is the orientation you must have. What is anterior to the scalenus anterior muscle? Anterior to scalenus anterior muscle is a nerve. Which nerve? Which nerve? That is the phrenic nerve. So if you say phrenic nerve is anterior to scalenus anterior muscle, what is the muscle covered by? The prevertebral fascia. This is prevertebral fascia. So this is prevertebral fascia in front of the vertebra. Yes, not only in front of vertebra but in front of muscle also. Which muscle? The scalenus anterior. So there is a nerve which is in front of scalenus anterior muscle and covered by the prevertebral fascia. So what is this nerve which is behind the carotid sheath? Oh, you are relating some nerves with each other? Yes. In front of the scalenus anterior, you have phrenic nerve? Yes. What is behind the carotid sheath? Behind the carotid sheath, I think stellate ganglion, sympathetic chain? Yes. What is this nerve? That is a vagus nerve? Yes. What is that nerve? That is the recurrent laryngeal nerve? Yes. That is what you have to remember. Remember the orientation, because examiner what they are doing is giving you a CT scan MRI, asking A, B, C, D, and you know nothing, because in CT scan things are not clear. They'll say this is A and this is B and this is C and this is D. Tell me who is who. Who will be the most posterior? Actually, brachial plexus. Why brachial plexus will be most posterior? Why the brachial plexus will be more posterior? Because it is behind the scalenus anterior muscle, actually lateral to scalenus anterior muscle. So lateral to scalenus anterior muscle, that is where we block the brachial plexus. Yeah, sandwich between the other, which is scalenus medius. Oh, interscalene triangle. Yes, interscalene triangle. So as you're talking about interscalene triangle, You are telling that this is the brachial plexus. Most posterior brachial plexus? Yes. Behind or lateral to scalenus anterior. In front of scalenus anterior, the phrenic nerve. And what is here? Behind the carotid sheath, it is the sympathetic chain. And what is inside the carotid sheath, bounded by the two vessels? See, in the CT MRI, what you see is some vessels, they are evident, and between and behind the vessel is the vagus nerve. And what is between the two tubes here? This tube will be also evident in MRI CT scan. That is the trachea, this is the esophagus, some air space will be there. Esophagus is normally collapsed, but the air space will be there. So between the two, you will have some nerve marked A, B, C, D. So just have some orientation. Most posterior brachial plexus. This is in front of the scalenus anterior, the phrenic nerve, and behind the carotid sheath, the sympathetic chain, and within the carotid sheath is the vagus nerve and tracheoesophageal groove. It is the recurrent laryngeal nerve, branch of vagus nerve, tracheoesophageal groove.